Hi everyone, I'm excited to share that the FDA approved a new non-hormonal medication for the treatment of vasomotor symptoms, hot flashes, night sweats. The drug is called elinzanetant, and it is in the same category as Veozah, which we already have is a non-hormonal medication for hot flashes. Now, Veozah blocks the neurokinin 3 receptor, which is involved in temperature regulation in the brain. Elinzanetant not only blocks neurokinin 3, it also blocks neurokinin 1. And neurokinin 1 receptors also involved in sleep. And in the big studies with elinzanetant, they saw pretty significant reduction in vasomotor symptoms, improvement in sleep, improvement in menopause-related quality of life. Now, Veozah does improve sleep for some people, and these two drugs have never been studied head-to-head, meaning one versus the other. So we don't actually know, is one better with hot flashes, with sleep, with night sweats, but this is really an important option to have, and I'm thrilled that we have another option. The drug should be available starting in November, and they do say on their website that there are going to be patient savings and assistance available. I mean, one of the big challenges that we have with Veozah is insurance coverage and cost, and so we'll see how having another drug on the market may impact that or may change that. The other important thing is that elinzanetant has been studied in patients with breast cancer, and that is on the OASIS 4 trial. Let's take a look at that study. This is the research summary from the OASIS 4 trial, which looked at elinzanetant for vasomotor symptoms from endocrine therapy in patients with breast cancer. It was published in the New England Journal of Medicine. They had 474 patients, average age of 51. And you can see about 316 patients received elinzanetant and the rest received placebo. And what you can see is that there was a pretty significant reduction, nearly double the reduction in hot flashes, night sweats, that vasomotor symptoms at week 4 and week 12 in the elinzanetant arm compared to placebo. But what's interesting is that there actually is a placebo effect, because you can see even in the placebo there was an improvement in the average amount of frequency of vasomotor symptoms. I'm going to tell you about the side effects in a second, but this does support and provides evidence that we can use this medication in patients with breast cancer. Now, we've been using Veozah in our patients with breast cancer for a long time, but I love seeing more data specifically tested in our patients with breast cancer. This is the information from Bayer, who manufactures the drug. Big thing is it can cause daytime impairment, somnolence, sleepiness, and so it is recommended to take the medication. It's a daily pill to take it at bedtime. Just like Veozah, we have to monitor the liver enzymes, and then common side effects: headache, fatigue, dizziness, GI symptoms, rash, diarrhea, some muscle spasms. So these are all things that we're going to keep in mind. Now, I don't have any experience clinically using this medication because it just got approved. Once we start using the medication, we'll be able to see how people are doing on it. All right, so I think it's a great option. I'm thrilled we have yet another medication in this space. Let me know all of your questions. Let's talk about it.